everyone. I'm joined here today with my friend Dr. Mark Breiner. He owns the Whole Body Dentistry out of Fairfield, Connecticut. Recently, I made a point of having my mouth checked out because I knew I had mercury fillings. I remember watching a video last year and I started to get concerned. I wanted to be proactive about my health. I wasn't really having any issues, so I seeked out Dr. Breiner. He confirmed, I believe I had 9 fillings that needed to be replaced. I did the treatment. I'm very happy I did. There were no issues, just maybe a little sensitivity afterwards, but I thought it'd be a good time to have my audience learn more about mercury and other dangers like fluoride, for example. So, Dr. Bryan, I wanted to start out with what role does diet play in keeping our teeth healthy?
Oh, it plays a huge role. The teeth are made up. You have enamel on the outside of the tooth, and you have dentin under the enamel, and then you have your pulp or your nerve tissue. And they're all connected by millions of tubules. Okay, and these tubules have a fluid flow. Now, in a healthy state, the fluid goes from inside to outside. When you take in a lot of sugar, let's say, and your diet isn't proper, the fluid flow goes the other way and goes from outside to inside, and that brings bacteria in and starts a process of decay. A man named Steinman did research on this years ago, and so that start taking in a lot of refined sugars and refined foods, that's going to affect the fluid flow. So naturally, you don't want to be taking those things in.
Right.
The diet is paramount. You can actually take teeth that are decayed, and you can arrest the decay if somebody's on a proper diet. Now, most of the time, you don't wait for that because you don't know, how long it might take, and you don't want a
Right.
person running into trouble. But you can reverse decay.
Yeah, that was one of my questions as well. So it can be reversed if, as long as you're eating correctly. Um,
Yes.
yeah.
Yeah.
Uh,
And other factors enter into it, genetics and things like that.
yeah.
Naturally, I do a lot of homeopathy.
Mhm.
And so homeopathy deals a lot with changing a person's susceptibility to things. So that becomes another avenue.
Right. I was reading recently, somebody shared an article about stem cells that can heal cavities. Have you heard much about that?
Well, they're doing a lot of research with that. And I'm pretty sure, stem cells are ubiquitous today in a lot of different areas and a lot of research. And yeah, they're doing research and finding, let's say you have a pulp exposed and you have a tooth that's abscessing, where they're actually finding they can take stem cells and regenerate the pulp. It's not standard treatment yet, but the research is going there. And I think at
That's
some point you're
amazing.
going to find that, yeah, you can reverse the decay with stem cells. You can revive a tooth that's dying or abscessed. So it's pretty exciting.
It is. It is. You opened my eyes about fluoride, and love for my audience to hear about the dangers of fluoride because I used to hear about it over the years, but I never really paid much attention. But I did get a carbon filter for my water for the whole house, and I noticed a huge taste difference. And I'd love for my audience to hear more about the problems with fluoride.
Well, fluoride's a poison, and it's a byproduct of the aluminum industry and nuclear industry. And it's a matter of, do you get paid to take away the fluoride, or do you have to pay to take away the fluoride?
Right.
So this goes back. They talk about, the ADA talks about the studies showing the positive effects of fluoride in drinking water. Well, what happens is they did the original studies, and they stopped the studies and, oh, wait a minute, the fluoride has cut down tooth decay. And that was in, I believe, Grand Rapids, Michigan. And the problem is, what they didn't show is that the control city had the same decrease in decay as the city in which they fluoridated the water. There were other factors going on. And there's never, ever in the entire world been a study to show that fluoride in drinking water will decrease tooth decay. Now, it's a big problem. Fluoride being a toxin, and there are hundreds of studies now show that putting fluoride into drinking water, you decrease the IQ of people. You also cause increased cancer. You have all sorts of problems. And the big problem is, think about it. Now, let's say, Rich, you weigh 160, 70 pounds, and you drink 2 cups of water, 2 glasses of water, has a certain amount of fluoride in it. But now you take an infant that's weighing 7, 8, 10 pounds, and you're giving them in their formula or giving them in their water 2 glasses of water. They're getting the same dosage as you're getting.
Oh, that's a good point. Yeah.
So you're, and there's no reason to have it, okay? Because it's not going to cut down tooth decay. It's just going to cause problems. And but to take a medication, when you do that, you're usually giving drugs according to weight, and the dosage is going to be adjusted. And now you're giving everybody the same dosage. It makes no sense. Now, fluoride in toothpaste will have some positive effects because it does kill. So it will kill bacteria and all, but it's much better to work on your diet and doing things in a positive way to prevent tooth decay rather than ingesting the fluoride. Now, when you brush your teeth, okay, most of the time you're expectorating it, so that's good, but it's still a toxin. You know, I'd say if a baby gets a hold of a tube of toothpaste and ingest that, they can die. Wow. And as far as using fluoride treatments in dental offices, children have died because it is toxic. And unfortunately, you know, I find a big reason that fluoride is used in a dental office treating the teeth is because insurance pays for it. Mm-hmm. So dentists will say, oh, let's do a fluoride treatment because it's pretty quick to apply the fluoride and they'll get good reimbursement.
And really, there's no added benefit, right, at all with the treatment?
It can have a little benefit, but the risk, I think, is really too great.
Yeah, yeah.
I mean, I haven't used fluoride in 40 years.
Yeah, I don't miss it myself. I also worry about, you know, my knees, which healed, and I understand it could lead to osteoarthritis and different issues like that. And you know, upon reading about it, and
you know, and then you don't even think about it. I remember one case I had a mother. We were talking about it, and the child had eczema and this and that. And I said, you know, we'll cut out the fluoridated toothpaste that they were using and water, and then that cleared up the eczema. Yeah. So it's just not worth taking in such a hazardous chemical.
Right. And I never expected, I used to get these sores on the side of my mouth. I think I told you about that. I haven't gotten them since I gave up the fluoride.
Right.
Yeah.
Yeah, that's another side effect.
Yeah. Can you talk about the dangers associated with mercury? Because I know there's videos out there, and that's what woke me up to get it checked out. But yeah, I'd like my audience to hear more about it.
Well, the so-called silver filling is 50% mercury, and the other half is copper, zinc, a little bit of silver thrown in, and is really a marketing ploy, because this goes back. They already had arguments in the 1830s when they were started using these fillings about how dangerous they were, and they had published articles in the medical journals about problems occurring once people started having these mercury fillings. Mm-hmm. And so it was really a marketing play. Let's call them a silver filling. You know, silver's one. I don't mind having a silver filling, but you start talking about putting a mercury filling in, you know, that's different. There is no safe level for mercury in the body. It's the most toxic non-radiation element known. And you say, well, the tooth is very tiny. How much mercury can you have in a filling? Well, your average 4-foot fluorescent light has 12 milligrams of mercury. And I don't know if most people are aware, you're not supposed to throw these in the garbage when you want to
Right.
get rid of them. You're supposed
Yeah.
to take them to Home Depot or the fire department where they can be gotten rid of in a safe manner because of that 12 milligrams of mercury. Because then if you break it in your house, you break one of those bulbs, you can cause a hazardous problem. So you have about 12 milligrams, the average 4-foot fluorescent light, and in a bulb about 6 milligrams. In the average molar filling, you will have 750 to 1,000 milligrams of
Wow.
mercury.
Wow.
Now, the problem is this mercury comes off as a gas, and you're taking it in, it's going straight to your brain, you're inhaling, it's going to all your organs and tissues. And mercury is extremely toxic and affects the cellular workings, mechanisms inside your cells, and can cause almost anything from heart disease to, some associated with Alzheimer's, but it definitely is a neurological poison. If you remember Alice in Wonderland and
Yep.
being Mad as a Hatter, well, that's because in Danbury, where it was a big hat industry, they would polish the felt with mercury, and people would go crazy.
Yeah.
And that's where they got the term Mad as a Hatter.
Wow.
So, yeah, mercury just has so many side effects and possible health effects. I mean, you could just list almost anything. So, one thing I would say, though, I must caution people that you don't want to just run out and say, hey, doc, take out my fillings, because it is so hazardous and does come off as a vapor. Anytime you stimulate that filling, be it with brushing your teeth, taking in hot liquids, grinding your teeth, you actually have more mercury coming off. Studies show that if you start chewing on these, you have 15 times the amount of mercury coming off as at rest. So if you go and touch that filling with a dental drill, you get a huge plume of mercury vapor.
Right.
So you need to go to somebody that knows how to safely take these out. And it's not only a matter of taking them out at the time you're actually taking them out, how you do it safely. Like we have the patient, the teeth are isolated with what's called a rubber dam. So you don't have everything going down your throat. We have a big vacuum right in front of your face that's sucking out the vapor. Patient is on oxygen. We put a powder inside the mouth, helps bind mercury. Doing all these things to protect the patient. We wear hazmat, special mercury masks, myself and my assistant. You want to do things to protect yourself, but it's also very important to protect yourself to start the process prior to taking the fillings out,
Mm-hmm.
and then afterwards to help exit, and not only mercury, because remember it's copper, tin, zinc, silver. You also got to help the body exit these heavy metals. And because some people, if you start researching this online, you'll see it say, oh, I had my fillings out and now I'm sick. I wasn't even sick before, or I was sick and now I'm sicker. Because you must do this in a proper way before, during, and after.
Right. So I remember I had anxiety afterwards, thinking, "Oh my God, what if I get sick?" But you did all the precautions, and the only problem I had was a little sensitivity that went away. And I gotta say, it was as scared as I was going into it, it was so easy. I mean, yes, a little inconvenient, but everybody made it easy there.
Good.
Yeah.
And that's usually it. And I'll tell you the two things that are, that over 90% of people notice when they take these out are increased clarity of mind and more energy. And over 90% of people report that.
Yeah, I can definitely see why. And I did notice a difference. It's hard to explain in words, but it's definitely a big improvement.
Well, that's good because you went into this feeling really good.
Right.
So
Yeah, as I said,
you do,
I was
you're in
proactive. Yeah.
good shape. Yeah.
Yeah. What are your thoughts on root canals? I know that's a controversial topic. You know, some dentists are all for it. Some talk about the dangers.
Yeah, well, a root canal is done if the tooth is dead or dying. And so really what happens, let's say a tooth is abscessing, the patient is confronted with a decision. Do I do a root canal, which involves going into this pipe inside the tooth that contains the nerve and blood supply and lymph supply? What happens with the root canal, you go and clean that pipe out and then you seal it up with a inert material. So that is, now you have a dead tooth. You have something that's dead and gangrenous essentially in your mouth. Now, the only other option is to completely take the tooth out. So that presents a problem. When you have this dead tooth, the research shows it can cause almost anything from mental disease to heart disease to arthritic problems. It can cause almost anything. Research was done many years ago by Dr. Weston Price to show this. And he was a very meticulous researcher. And at one point was head of research in the American Dental Association. So now I look at it, I do energetic testing. We can test the teeth. Some people are like, they can't stand the thought of taking a tooth out. Let's say you're 21-year-old, female, and you have an abscess on your front tooth, and you say, look, your choice is a root canal or take tooth out. It's like, oh my God, I can't lose my front tooth.
Right.
What am I going to do? So I look at it, really, you have to take the whole patient into account, right? Because the mental problem with the person taking that tooth out may be worse than the root canal itself. All right. So the safest thing is you never have a root canal. But on the other hand, you have to take everything into consideration. And if a person decides to do a root canal, and a certain percentage of my patients can't stand the thought of losing a tooth, they'll do the root canal and we can see how it's affecting them energetically. We can test how it's affecting them. Now, the other thing is, I want to say is, again, I do what's called whole body dentistry.
Right.
So most people that come to me are sick and they're not doing great health-wise, have a lot of problems. So one of the things we do is we work on the health of the patient. And a lot has to do with if you will tolerate a root canal on how's your immune system and can you quarantine the toxins? I mean, Dr. Price showed that if you can quarantine the toxins coming off the root canal, you'll tolerate it. So some of it, now every tooth is on an acupuncture meridian. Every tooth relates to different organs and tissues and vertebrae and muscle groups. So it's a two-way street. You can have the root canal that's affecting the associated organ, or the associated organ can be affecting the root canal or any tooth. Like I've had people come in, they have a toothache, and the problem was not the tooth, but the associated organ.
Wow.
So you take care of the problem with the associated organ and the tooth feels better. So you always need to keep this in mind. And, my book, I talk about detective stories. You have to be a detective and figure this out. So with root canals, some people have, let's say, 3 root canals, and we find that 2 of them are bad and 1 is okay. And so it's very individualized, and a lot has to be done in concert naturally with the patient and where they're at health-wise. Patients come in and I'll say, look, unless they're in pain, I said, let's wait on assessing these root canals. Let's get you healthy. And like patients come in, one of the first things I ask, if you remember, Richard, is on a scale of 1 to 10, with 1, you're feeling absolutely terrible, and 10, you're feeling superific mentally, physically, emotionally. Where are you? And my average patient will say I'm a 3 to a 4.
Wow.
They're not doing well.
Yeah.
So let's get you up to, let's say, a 7, 8 or higher, and then let's then test these root canals. Because if somebody comes in and they're a 3 or 4, I can almost guarantee if I test the root canals at that point, they're all bad.
Mhm.
Now,
Yeah.
when we get them to a healthier state and their immune system is functioning better, and we test the root canals, they may still all test badly, or they may test okay, or some may be good, some may be bad. So I like to, if we can, hold off. And the same thing occurs with what's called a cavitation. And a cavitation is a hole in the bone where a tooth has been removed and the bone doesn't heal right. The tissue heals over, and that's good, but the bone itself has a cavity, doesn't heal right. And that becomes a cesspool
Mhm.
for bacteria, for heavy metals, for mold, for all sorts of viruses, everything. And typically years ago, what we do is you go in, and this was still done by most holistic dentists, is you go in surgically and you clean out that hole and hope that it heals.
Mhm.
But unfortunately, what I find very often, people come in that have had that surgery 2, 3, 4 times, and they still have a cavitation. The reason being, just like with the root canal, before you do anything, before you assess it, you want to go in and get the patient to a healthier state, get them where they can heal. And then if you need to do the surgery, do the surgery. And the odds of success go way up. I mean, I find most of the time, I haven't done a cavitational surgery in years because we can usually heal this, have the body heal itself
Right.
by working on the whole person and then injecting ozone gas right into the bone. And
Is there
so I
any way to
find that
tell? Is there any way to tell a cavitation is there through X-ray, or how do you know it's there?
sometimes you can see it through X-ray. I find the best way is to check energetically.
Mhm.
And I think everybody, you have cavitations not only in the mouth, you'll have them in long bones, osteopathic, surgeons find this. Um, so I find, I think everybody probably has a cavitation, but is it affecting them? And that's why I find energetically, for me, I find that's the best way to evaluate it. And cavitation, just like root canals, can have total systemic effect. I mean, I just had a patient come
Sure.
in. It's interesting. She had cavitation, and somebody wanted to do surgery on it, and she came to me, and we injected. She'd been worked on, got her to a good place. We injected ozone gas, and what's really interesting. So when you inject ozone gas, it'll follow the infection.
Huh.
So this person, we injected it. Okay, now she was having a shoulder problem and a hip problem, and she could feel the gas go around to the midline of her jaw, go down into her shoulder, and go down into her hip. Now, there's no way doing surgery that you can go and clean out that infection.
Right.
Right? I mean, you may be able to debulk a certain area, but the fact that that gas went, say, to her midline here, how are you going to clean that bone up? And the fact that that infection was down to her shoulder and hip, it's all coming from that cavitation. And by working on her overall health, and then that gas goes and will go and kill the bacteria and the viruses and everything, and start a healing. And so she came in like 2 weeks later, and my hip is 75% better, my jaw
That's
pain is
great.
90%
Yeah.
better. Say so. That's why the gas is really a fantastic adjunct.
And they didn't use that for very long, right? They started using maybe 10 years ago or so, or
Yeah, came in probably a little more. I mean, I've been using it probably 20 years now, I'd say.
yeah. It's probably one of the best inventions, I'm sure, for your dentistry. One of
Well,
the,
for cavitation,
yeah,
certainly.
yeah,
Because like I said, I haven't really had to go in and do surgery.
yeah, that's a great thing. Can you discuss the issue about cross bites? because as you know, I have one, and I never really gave much thought, but
Yeah, well, a crossbite is normally, let me see something. I have a,
sure.
here I have Yorick here. So what happens is your upper teeth, okay,
Hmm.
these are your back upper teeth should come out over your lower teeth.
Hmm.
All right. Now, crossbite is that this will be inside.
Right.
So it's that way. And usually it's bilateral, it's on both sides. And truthfully, a crossbite is pretty stable and don't find many problems, except that because the jaw is restricted,
Hmm.
very often that can lead to a diminished airway and can contribute to sleep apnea.
Wow.
That I would find is the biggest problem. Or if somebody has a broad smile and aesthetically it's not as pleasing, so they may want to expand the jaws, which can be done to correct the crossbite. And if somebody has sleep apnea, I would definitely say they want to correct that crossbite.
Well, what is the process like? Does it take years to correct, or?
No, no. You do it orthodontically, you put some appliances in, and you actually go and have to expand that bone. You have a suture down the roof of the mouth,
Mhm.
and you have to kind of expand that suture. And it just has to be done slowly,
Yeah.
and but can be done even in an adult. I mean, it's best done when you're a child.
Right. Can you talk a little bit more about the meridian? The tooth is on the same meridian as, say, an organ. Um, I
Yeah,
like.
there's a chart, and I have it like in my book. There's a chart. There's a man named Dr. Voll. Dr. Voll was a German physician. He was an anatomy professor. He was a surgeon. He was an acupuncturist and a homeopath. And he spent 40 years doing research and developed a chart showing how every tooth relates to different organs, tissues, muscle groups, vertebrae. And so we see this all the time. And that's why we want to be cognizant of this, because of people can come in with problems. And like I had said before, the problem can be more from the organ than the tooth. I'll forget, like one patient, or she came in, she had her eye tooth, she had terrible pain. And she was like, please, I think I'm going to need a root canal on this tooth. What can I do? And I checked the tooth out. I didn't find any problems with the tooth. The problem was her gallbladder.
Wow.
Okay.
Really?
So in checking energetically, yeah, the problem was the gallbladder. So we gave her some homeopathics to help the gallbladder, and then that was the end of the tooth problem and took away the pain.
Have you had any clients that maybe would come in maybe with a hip pain or a knee pain, hoping that it's their teeth? Maybe they made the connection themselves.
Yeah,
And yeah.
yeah, you'll see that, and you'll see that with root canals,
Hmm.
especially in cavitations. And sometimes you can see it with fillings, in that the fact that these fillings are dissimilar metals, they create a battery. When you take dissimilar metals, put them into a salt solution like saliva, you create a battery. And sometimes you'll see so much current being generated, you're interfering with that acupuncture meridian. It could cause trouble.
Yeah, I remember
And
checking my the battery level. That was an
yeah,
interesting process. Yeah.
so yeah, we see it. And this connection, and you don't have to have a direct connection from things going on in the mouth with affecting different areas of the body. I mean, a lot of times that'll help us, but an infection in the mouth or a problem with root canal can affect almost anything. Matter of fact, it's interesting. I just had a patient. She had a problem. She developed she broke her finger. They put a pin in it, her pinky finger, and put a pin in it. She developed severe infection, terrible infection. At one point, they even thought of amputating the finger. And then from what happened is terrible pain. She has constant pain with this finger, and she's been 12 years all over trying to figure out what to do. And the biggest problem is infection from her root canals.
Wow.
Yeah.
Yeah.
So taking care of that and addressing that, the pain's going away. It was always swollen. That's going down, and she's getting mobility again.
Yeah, this is an important message also because I told you about my dad. He has giant cell arteritis, and he's dealing with teeth issues. And I'm trying to tell him, but he thinks I'm out of my mind, that maybe it's related to the root canals that he has. He also found out he needs another root canal, and I'd love it if he would see a natural dentist. He's down in Virginia, but it's just sad that some people aren't open-minded about it really could be what's in your mouth.
Yeah. I mean, the research is there.
Yeah.
I mean, the American Dental Association doesn't like to admit it, but it was done. And the research was done years ago before antibiotics, when I think you had a lot clearer picture. It wasn't blurred by giving an antibiotic to quell the infection, and you could see the connection more directly between the teeth and what was going on in the rest of the body.
Right. Do you find the antibiotics are helpful in some of your patients, or does the ozone usually take care of the problem?
Like if we're working on a cavitation, I don't use antibiotics. No, we'll use homeopathics and the ozone gas.
Yeah.
And working on getting toxins out of the body.
Right.
I guarantee anybody who comes in and is in that 3 to 4, 5, 6 category on how they subjectively feel, they're toxic. They're going to be toxic with heavy metals, with pesticides, with chemicals and solvents, very often with mold, parasites. I guarantee toxicity today in general, is a huge problem. We're just living in a toxic world.
Yeah. It's probably just getting worse, I'm sure.
Yeah.
Unfortunately. Yeah. We talked a little bit about root canals. What are the best alternatives to somebody just is dead set against them? Is the
Well,
only an implant, or
you have to take the tooth out, and then you have an option of replacing the missing tooth, let's say with a bridge or with a implant. Now, a bridge essentially, show this. Let's say you lost this tooth over here. You could take the tooth in front and behind the missing tooth and do a bridge, which means that you're connecting to those teeth on either side. Just like George Washington Bridge, you have your pillars and it holds up the structure. So that's a bridge. You have to do what are called, the traditional way of doing it is by putting a cap on each tooth on either side of the space to hold the missing tooth. Now, the disadvantage to that is, in a conventional bridge, you have to cut those teeth down. You have to mutilate those adjacent teeth. And I don't like to do that because you increase the odds they may need a root canal and die. So if a person wants to do a bridge, we want to do a very conservative bridge where we're not taking away very much tooth. We're really not taking away more tooth structure than a filling. The disadvantage to that is because you don't have as much bonding area, so it'll tend to come loose periodically. The other option is an implant, where you're going and putting essentially a screw into the bone where the tooth was, and then building a superstructure over that, like a tooth to replace the missing tooth. So the advantages and disadvantages are, you are going in on an acupuncture meridian to do an implant. I find if a person is healthy and everything's good and we've worked on everything, I don't see a problem with it, as long as it's a ceramic implant, which is very safe biologically, compared to a titanium implant, which is the way most people do implants. But then when you do a titanium implant, it does corrode, and you do have titanium then going off to all the cells of your body. And you also have electrical currents. So if a patient chooses to do an implant, I always recommend they do a ceramic implant.
That makes
And then
sense.
if they don't want to do an implant, then to do a bridge that's as conservative as possible,
Mhm.
so you don't jeopardize those supporting teeth.
One thought I had is the screw you're talking about that they have to put in the mouth. Um, you probably worry about what kind of metals are in there, right? In the screw
Well,
is,
that's why you want to do titanium.
yeah,
You want to do a ceramic,
yeah.
because then
Oh, the
nothing's
screw as well then too.
when, yeah, essentially the it's like a female going into the bone. When that integrates into the bone, then you're taking a male part into the female part that creates above the gum line, essentially a basis for a tooth to put a crown over that. And when we do it, we do everything non-metal, everything ceramic. So there are no electrical currents and nothing coming out into the system.
And those typically last like basically for a lifetime,
Yeah,
right?
yeah. If you take care of it, you have to take care of them just like a
Oh, of
tooth.
course, of course.
Yeah. I mean, some people have seen some failures in root canals, but it's a very small percentage.
Right. Do you have any final thoughts for people who might be having health issues? People who are on the fence, maybe they have a lot of issues going on in their bodies. Um,
Well,
what advice do you have for them?
I would definitely check out the mouth.
Yeah,
I mean, there's so many things related to the mouth. Now, um, but again, the caveat is you want to make sure you go to somebody that is trained in all this and knows what they're doing.
right.
And that's one of the reasons I wrote my book, Whole Body Dentistry, is so people can read about this and know what questions to ask the dentist. So you can find out indeed, is this the right person to address my issues?
And it's a great reference book. I highly recommend it to everybody. Yeah, you did a really good job with it.
Thank you. Thank you.
Yeah.
The other thing is I just like to caution people. I if you have dental insurance, be careful. I find, like, I don't take insurance. I find that you have to be careful. I find a lot of, unfortunately, unnecessary dentistry being done because of insurance.
Yep.
Because they say, oh, well, this is covered on, like, just like the fluoride treatment. It's covered under insurance. Great, let's do fluoride treatments. Person has a large filling, needs replacing. They say, okay, let's do a crown. Because if you take dental insurance, you really can't make money doing a filling. You have to do crowns to be able to make any money.
Mhm.
And I know my colleagues don't like me speaking out on this, but unfortunately, I find this to often be the case. And when you do that crown, you mutilate the tooth. You can be then into a root canal. And so I find dentistry should be done is in a conservative a manner as possible. And I find it interesting, a person can have a big filling. They've had this big mercury filling in their mouth for 25 years. And now it's breaking down. And I say, well, now you need a crown. Well, I say, well, why? I can put what's called a ceramic filling, a composite filling into that tooth, which will bond to the tooth, strengthen the tooth, and not have to do a crown, and probably get 20, 25 years, another 25 years out before you have to replace it. Right. So the mercury fillings, as they corrode with time and they start to expand and start to break your teeth. So to me, to say, well, you have this filling for 25 years, now we got to replace it, we should do a crown, doesn't make sense to me. Let me do a bonded filling. It's harder in some ways, but it's a lot more conservative. So I don't do a lot of crowns. So I'd also just caution people to beware of crowns.
And I also have to say that insurance, they don't cover much, but they do reimburse. So it depends on somebody's insurance, and your office is very good about giving the forms.
Right. We give the forms and the patient gets reimbursed whatever
Right.
level they'll have. But don't let that make the decision for you on what's best for you, and put your health first.
Yeah, I agree. Totally agree. Yeah, I think everybody should keep health priority.
You want to stay young.
Yeah,
Look at you. You're
exactly.
getting younger, Richard.
Right. So, what's the best way for somebody to make an appointment? Just call the office. I'll include the phone number in the website link below the
Okay.
video.
Yeah. Or they can go to wholebodydentistry.com
Yeah.
and check it out, or wholebodymed.com. We have a whole facility here with the medical side and dental side, which is pretty unique. Very few places in the country take both sides together.
Right. And your son is in the other practice, right? In the other side?
Right. He's a naturopathic physician. We have hyperbaric oxygen. He does a lot with Lyme and brain issues and traumatic brain injuries. We have other physicians here, functional physicians, osteopaths. And we have full gamut of different things, and a lot is energy based.
Yeah.
So
Yeah.
we get great results.
Right. Well, but I'm a living example. I'm so happy I had the mercury removed. I can't explain, but psychologically, I feel better without it in
Good.
my mouth. So yeah, I mean, I highly recommend it. My audience, if you're looking to improve your health, seek out Dr. Breiner.
All right. Thank you.
All right, thank you so much. This is very informative. I'm sure you opened
All
a
right.
lot of eyes.
All right. Have a great day.
Yeah, you too.